Hello, how are you? My name is Jeremy. I'm going to be reading from NSCA's Essentials of Strength Training and Conditioning. I'm going to be on page 110. Cardiovascular and Respiratory Responses to Acute Exercise. Acute and chronic anaerobic exercise have a significant impact on cardiovascular and respiratory function. This has been evidenced by enhanced cardiac function and dimensions in anaerobic athletes. Acute and chronic responses to heavy load resistance training are differentiated when possible from responses to more repetitions of light loads with less rest. Resistance training can benefit the cardiovascular system, but in a manner different from conventional aerobic endurance training. Improved ability of the heart, lungs, and circulatory system to function under conditions of high pressure and force production can prepare the athlete's body for extreme competitive demand. Wow, that was a good intro. Cool. Acute cardiovascular responses to anaerobic exercise. An acute bout of anaerobic exercise significantly increases the cardiovascular responses, especially if the individual uses the Valsalva maneuver. Heart rate, stroke volume, cardiac output, and blood pressure increase significantly during resistance exercise. Peak blood pressures of 320 over 250 millimoles of mercury and a heart rate of 170 beats per minute have been reported during a high intensity, 95% of 1 rep max, leg press exercise. Generally, the blood pressure response increases non-linearly with the magnitude of active muscle mass and is higher during the concentric phase of each repetition than during the eccentric phase, especially at the sticking point of an exercise. Although large elevations in blood pressure have been shown, no data exists to indicate that resistance training has any negative effects on resting blood pressure. In addition, intrathoracic pressure increases and plasma volume reductions up to 22% have been reported. Acute anaerobic exercise results in increased cardiac output, stroke volume, heart rate, oxygen uptake, systolic blood pressure, and blood flow to active muscle. Cool. During a set of resistance exercise, stroke volume and cardiac output increase mostly during the eccentric phase of each repetition, especially when the Valsalva maneuver is used. Because the concentric phase of repetition is much more difficult and elevations in the intrathoracic and intra-abdominal pressures are more prominent, limiting venous return and reducing end-diastolic volume, the hemodynamic response of resistance exercise is delayed such that cardiac output increases more during the eccentric phase or during the rest period between sets. This is especially true for an individual's heart rate response. During the first 5 seconds after completion of a set, heart rate is higher than during the set. The degree to which blood flow is increased in the working muscles during resistance training depends on the intensity of resistance, length of time of effort, the number of repetitions performed, and the size of the muscle mass. Lower resistances lifted for many repetitions produce responses relatively similar to those with aerobic exercise. However, heavy resistance exercise decreases blood flow to working muscles. Muscular contractions greater than 20% of maximal voluntary contraction impede blood flow during a set, but blood flow increases during the rest period, reactive hyperemia, after the set. Interestingly, the lack of blood flow and subsequent increase in metabolites such as lactic acid and reduction in pH, is a potent stimulus for muscle growth. Overall, the magnitude of the acute cardiovascular responses depends on the intensity and volume of exercise, muscle mass involvement, rest period length, and contraction velocity. Cool. How long are we gone? Chronic cardiovascular adaptations at rest. Resting heart rate may not change significantly in response to anaerobic training. Short-term resistance training has been found to lead to decreases of 5% to 12% in resting heart rate. Resistance-trained athlete, bodybuilders, powerlifters, weightlifters, have an average or lower than average resting heart rate, 60 to 78 beats per minute, compared to untrained individuals. Longitudinal studies have shown either no change in resting heart rate or reductions of 4 to 13%. Resting blood pressure may decrease slightly or not change at all. A meta-analysis showed that both systolic and diastolic blood pressure decreased by 2 to 4% as an adaptation to resistance training. It appears that the response is greatest in those individuals who initially have a slightly elevated blood pressure. Similarly, the rate pressure product, heart rate times systolic blood pressure, a measure of the myocardial work, has been shown to either remain constant or decrease following resistance training. Stroke volume has been shown to increase in absolute magnitude, but not relative to body surface area or lean body mass. Stroke volume will increase as lean tissue mass increases during long-term resistance training. Lastly, resistance training may either not change or slightly decrease total cholesterol and low-density lipoproteins and increase high-density lipoproteins. Therefore, heavy resistance training does little to enhance resting cardiac function, but greater improvements may be caused by adaptations to a high-volume program with short rest periods, i.e. bodybuilding and circuit training, in which the overall continuity of the exercise stress in a workout is much higher. Chronic resistance training also alters cardiac dimensions. Increased left ventricle wall thickness and mass have been reported, but the increase disappears when expressed relative to body surface area or lean muscle mass. It is thought that the increase may result from exposure to intermittently elevated blood pressures and increases in introthoracic pressure, in addition to accommodating changes from increases in lean body mass and body size. Highly resistance trained athletes have greater than normal absolute posterior left ventricular and intraventricular septum wall thickness. Little or no change in left ventricular chamber size or volume is observed with resistance training. This is a major difference between resistance exercise and aerobic exercise. Greater than normal absolute left and right ventricular in diastolic and in systolic volumes have been reported in bodybuilders but not weightlifters, which indicates that high volume training may be more conducive to increasing absolute left ventricular volumes. It is important to note that bodybuilders frequently incorporate aerobic exercise into their training programs. Therefore, it is possible that some of these adaptations may have been brought about in part by aerobic endurance training. Bodybuilders as well as weightlifters have greater than normal absolute and relative to lean body mass and body surface. Bodybuilders as well as weightlifters have greater than normal absolute and relative left atrial internal dimensions, with the bodybuilder showing a significantly greater dimension. We'll leave it there for right now. So that is page 110. Page 111 started from the intro, cardiovascular and respiratory responses to acute exercise, and ended on chronic cardiovascular adaptations at rest. Cool.